Is one of the most common cancers in the U.S. However, only a small percentage of adults say they've received a skin cancer exam. So prevention and early detection can reduce your risk. We talk about that quite a bit. So joining us now, Dr. Seerat Poonia from HCA HealthONE Swedish. Thank you so much for joining us. We appreciate it.
I'm glad to be here.
Yeah,
this
is a big topic, of course, since we're coming to the summer months now. So let's start about what that first question is. Why aren't people getting screenings often?
I'd say in large part it has to do with patients not knowing that they're at risk.
Okay.
Really, so much of it is in your control. It's maybe not always part of routine health maintenance. Seeking it out with your PCP at least once a year, and then ideally a dermatologist is what needs to happen.
Okay, PCP, primary care physician. Just
primary
want to make
care
sure.
physician. Yes.
So for people watching.
Yes.
We talked about summer almost being here, so let's talk about the do's and the don'ts when it comes for your skin.
Yes. So sunscreen, always.
Yep.
And I'd say in Colorado, no matter what complexion you have, you're already at risk because of the altitude and the fact that there are so many days of sunshine here. And so sunscreen, always. If you're going to be spending more time in the sun, then it needs to be at least SPF 30 to 50. Okay.
Yeah.
Hats with a brim, all right? More than just a baseball cap, a wide brim covering your ears.
Yeah.
Sun protective clothing.
Yeah.
All those things.
All right, since you mentioned the sunscreen, that is a big topic for a lot of people, right? And you mentioned the SPF, so 30 probably the lowest.
At least 30.
At least 30.
Yeah.
But I hear a lot about mineral sunscreen, about, you know, just the basic stuff that you get over the counter, like copper tone or banana boat, whatever. What is the right type of sunscreen that we should get?
There are so many types of sunscreen, and I would say you need to focus on SPF, UVA, UVB, broad spectrum coverage. Mineral sunscreen is a physical sunscreen, and then we also have chemical. The majority are chemical. Mineral is, it actually reflects the sun rays, and the reason that it's useful is that it's better for sensitive skin, often used in kids. The thing with that is that it's not necessarily water resistant, and that's a reason why a lot of folks tend to go toward the copper tone. I would say no matter what, you need to be reapplying sunscreen anyway after you get wet or you sweat, and so mineral works well for folks who have sensitive skin.
Okay, so the over-the-counter stuff that we see typically, that's
yes,
good.
it's all over the counter. So mineral is like the zinc oxide that you'll see that leaves the white on the face. I kind of like that because then you know that you're protected. But the chemical is also over the counter, and it's everything that you see.
Well, thank you so much for clarifying that. And what do you think people should get overall? I mean, as we approach the summer months in terms of Skin Cancer Awareness Month as well.
Absolutely. So a moisturizer that has SPF in it, so that when you're leaving out the door, regardless of if you're spending time outside, you're covered. If you're planning to spend time outside, have a hat by the door. Wear long sleeves. I know it's hot out there, but some people really are at higher risk. Fair complexion, redheads, freckles, anybody with immune suppression. You really have to be thinking about these things because that's what's in your control.
Yeah, and there's a lot of like different options when it comes to long sleeves as well. I went to Florida recently. I wore the long sleeve like hoodie. It's really thin. I mean, it's not too bad.
And buffs, they're breathable, things like that.
All that stuff.
Really fashionable hats, you know? You shouldn't be shy.
Yeah, exactly.
And then really seeking out skin checks, okay? Because that's not something that's going to be offered to you. It's like scheduling for the dentist. It should be part of your routine health maintenance as young as teenage years, really.
Well, great talk. Dr. Poonia, thank you so much for being here. We appreciate that. And you can watch all of our interviews on our website, cbscolorado.com. Michelle.
All right.